Hi everyone, my name is Dr. Sivasundaram. I'm an orthopedic sports medicine and shoulder specialist, and I'm here to talk to everyone today about what's new in rotator cuff surgery. So I'd like to discuss first my traditional technique for an arthroscopic rotator cuff repair. So this is a great animation from Arthrex that depicts a right shoulder. They've marked the rotator cuff here. The humerus bone is marked as well. There are multiple portals here, and the camera is on the in the posterior portal. So this is a grasper here that is now being utilized to grasp the rotator cuff. First, the bony bed for where we want our rotator cuff repair to end up is prepared using an arthroscopic burr. Then utilizing the arthroscopic camera for visualization, we place two anchors onto the medial part of the humerus. So this is the first anchor being placed right now. It is screwed in. These are absorbable anchors that use a PEEK or plastic composite to hold the sutures in there. So now you're going to see that a grasper is being placed into the joint. And then a suture passer is going to be utilized to pass those sutures through the rotator cuff. So we see that happening right here. That repair stitch will then be retracted to the side, and an additional anchor will be placed into the bone. And they've already kind of sped it up for us and passed the stitch for us as well. So now you have 4 strands of suture incorporated into the rotator cuff. And now we'll proceed with the rotator cuff repair. So the first thing we'll do is load our anchors there, reduce the cuff to see that it gets back down to the bone. And now you'll see the lateral row of the anchor being implanted into the bone, and that's going to reduce and fixate the anterior or front part of the rotator cuff repair. Next, we'll take those 2 additional stitches. They did note that there was a small, what we call a dog ear, or a portion of the rotator cuff that was not repaired by those other repair stitches. And so now we'll load all 3 of those anchors into all 3 of those stitches into a posterior anchor, and that will be fixated onto the humeral bone, and that is the complete repair. So this is a great animation because it kind of shows people what happens arthroscopically without seeing the video. It's more of a bird's eye view, so I really like this video. So one of the things that's new about rotator cuff repair surgery is this idea of patch augmentation. And the idea is, you can see a depiction of it on the top right of the screen there, is you have your rotator cuff underneath, and a patch is placed on top of the rotator cuff and secured with some absorbable anchors. And the idea is that it's a biologic augment to improve the healing. There are different versions of the rotator cuff repair patch out there. Some of them are dermal allograft patches, which are dermal, which is like almost skin tissue taken from cadaveric donors. And there are also xenografts, which are pig-based rotator cuff patch augmentation. So there's a variety of different implants out there, but the general understanding is that the patch is placed on top of the rotator cuff to improve biological healing. There's some data in the literature to show that it lowers the re-tear rate, and the advantage of a lot of these implants are that they are absorbable over time. So it's not like something that will stay in your body forever per se. Again, every implant is different, but a lot of them are absorbable over time. There is a solution now for irreparable rotator cuff tears. In general, what I mean when I say irreparable means that the rotator cuff tear is not repairable. In my opinion, a primary repair is always the best option for a patient, but there are many rotator cuff tears that are not repairable. And so for those patients, one implant that I do consider is this idea of what's called a balloon spacer. In this animation model, there is as you can see, a massive and irreparable rotator cuff tear, and the humeral head is exposed. So what this implant does is it gets inflated into the subacromial space and acts as a spacer to help depress the rotator cuff. Here you can see the balloon is keeping the humeral head down and almost functioning as if it is a rotator cuff. Again, it's a new implant and another option in our armamentarium for rotator cuff tears. I know that was a very brief review, but I think some of the takeaways for what's new in rotator cuff surgery is that there is a lot of options out there for rotator cuff tears, but each option takes a very patient-specific approach because every patient's activity level is different. The mechanism of injury of how the rotator cuff tear happened is different. The MRI findings are all very different. And so each person needs a different approach. And that's one of the nice things about rotator cuff surgery. And one of the things that I talk to people in the office about is that there are different repair options and strategies to get people pain-free, but it's a big discussion. The other kind of takeaway that I have here is that implant technologies are constantly evolving, and so staying current with the evidence and adapting to the improving technologies will help me personally take better care of my patients. So that's kind of one thing that I always think about is what is new out there, and what we can do better to help take care of my patients. There is the idea of biologics, whether that's platelet-rich plasma and bone marrow aspirate concentrate. Those are adjuncts to a good rotator cuff repair, and there is some data to show that these biologics may improve rotator cuff healing and reduce rotator cuff re-tear rates. I'd like to thank you again for taking the time to watch this video.